Hello, I'm Dr. Michael Cohen. I have been a chiropractic physician for 36 years. I'm the owner of Regenerative Wellness and also Cohen Chiropractic and Wellness. The reason I'm standing here telling you about regenerative therapy is because I suffered like you did, or some of you may have, due to an old injury when I was 16 years old. Over the next 40 years after the injury, my knee degenerated and my option was a knee replacement since I was bone on bone. And I did not want to do knee replacement therapy. So at the time, 5 years ago, I discovered what was called autologous stem cell injection, where you take stem cells from your own bone marrow and have it injected into the affected or bad joint. I did it. It was very, very painful as a procedure. And after the one injection and several PRP injections, my knee was better 3.5 months later. It wasn't 100% better, but 90% where I didn't think about it anymore. However, when you have a problem on one side of your body, without knowing it, you usually compensate and shift your weight to the other side. Therefore, you will start developing pain in the other joint that may have never hurt you before, and that's what happened to me. So my left knee, which never hurt a day in my life, was hurting me every single day and getting progressively worse. I tried many, many different therapies and nothing got it well. After having done the autologous stem cell on my first knee, I could not do that again. For me, it was too painful. Knowing what I would have had to have gone through one more time, couldn't do it. So after 2 years, I discovered a therapy called human umbilical cord therapy, where they took cells from the tissue of the umbilical cord and injected that into the painful joint. This was a very, very simple procedure, almost painless, quick. So I flew to Texas, had this done, and 3.5 weeks later, my knee was 90% better. So now I was able to have 2 good knees, go up and down stairs, get out of the car easily, get up from sitting, go to a restaurant, go on family vacations, sleep through the night. In other words, the pain that guided my life was no longer guiding my life. My first injection was 5 years ago. The second injection was 2.5 years ago. So once I had these experiences, I wanted to be able to deliver this type of therapy to my own patients, the ones that I knew were suffering, that didn't know what to do, and they wanted to do something before they did surgery. Because once you have a knee replacement, hip replacement, shoulder replacement, even low back surgery, you can't undo it. You're going to be working with that tissue that's most likely damaged to some degree. So I put together a medical team consisting of a medical doctor, Dr. David Blauweiss, and 2 nurse practitioners, Marissa Cohen and Rebecca Rivera, who administer the injection. The injection is a simple injection, not complicated. So with that being said, I'm going to explain to you what regenerative medicine is. Now, regenerative medicine is a cell-based type therapy to help your body heal the way it healed when you were a child. And as we get older, the level of cells in our body, those healing cells called mesenchymal stem cells, go down in numbers greatly. In other words, when you're an infant, when you're like a newborn, 1 in 10,000 cells is a stem cell. However, by the time you're 50 years old, it's 1 in 400,000. And by the time you're 80, it's 1 in 2 million. So we know that inflammation is the underlying cause of all disease. And when you have pain in a joint, it's also due to inflammation. And this therapy, one of the major benefits is it's a long-term solution to your inflammation. So if you can reduce inflammation, you're going to feel better and function better. So the regenerative therapy that we use today are exosomes. These are vesicles that are released from those same mesenchymal stem cells that came from the umbilical cord tissue before. Now they're coming from amniotic fluid, from mothers who give C-section births in the United States. So with this type of injection, healthy tissue is being developed, and it's preventing scar tissue, but restoring normal tissue function. So where you've lost range of motion, where you can't possibly stand up straight, your posture is off due to the compensation of your muscles and nervous system. If you can restore proper function, you can go back in time to the way you were before your pain began to start feeling better. And this is not a short-term cover up your symptoms type of treatment. This is long-term. Remember, I did mine 5 years ago. Many of the studies are 6 and 7 years out. So the idea is to reduce your inflammation, regenerate tissue, and also modulates your immune system to make you healthier all the way around. In order for the regenerative process to start, though, there has to be some inflammatory stimulus. So it could be an old injury, like a car accident. It could be a surgery. It could be a repetitive work that you've done, sports injuries. Something had to create a stimulus that's going to attract these exosomes or the combination of cells to the area. They will then promote anti-inflammatory effects to that area and create what's called angiogenesis, or a little more vascularization to help the healing process. And this will lead to new tissue. Once you have new tissue and less scar tissue, your range of motion can improve. And therefore, you can feel better with better function. That is the idea of cell-based therapy. Also, as you know, in medicine, with medications, there's many, many side effects, and we don't want side effects. With cell-based therapy, we have a word called side benefits. So patients will notice improvement in other areas or other things in their body. They may notice they have gut trouble for their life, and all of a sudden, their gut works better. Their energy is better. They may sleep better. They just feel better as a result because they healed in a way that they haven't healed in many, many years. These exosomes come from mesenchymal cells of the amniotic fluid. Now, amniotic fluid is that fluid that protects the fetus. And this fluid has the function of promoting homeostasis, it cushions, it lubricates, increases viscosity, reduces inflammation, and provides synovial fluid supplementation to the joint. And that's what's being used to inject, whether it's in the muscle near the spine, in the joint of the knee, near the hip. In other words, the injection doesn't have to go directly to the exact source of pain, because once these are deployed, once the exosomes or the cytokines or growth factors, proteins are deployed to the area, they're attracted to that inflammation. This is a natural process the body has. So they will then stay in that area and direct the traffic to help your body to heal. The different types of molecules in the amniotic fluid can be called chemokines, growth factors, hyaluronic acid, proteins, carbohydrates, mesenchymal stem cells, collagen. All of these things are found rich in that amniotic fluid. And the actual exosome is directing the traffic of your cells to heal that injured area. Now, people have many questions when it comes to this type of treatment, such as, where do we get it? Well, as I said before, it comes from healthy mothers who are actually having a C-section. And these products are then screened through strict FDA guidelines, just like any tissue-to-tissue transplant. If someone has a heart transplant, the same FDA guidelines. Blood transfusion, same FDA guidelines. So keep in mind, just like a tissue-to-tissue transplant, these are not FDA approved, but they do follow strict FDA guidelines. People also want to know, because they're familiar with, when you think of a stem cell type delivery, do you have to be donor matched? And there's no donor matching because these are neutral cells. And then the other big question comes up is, how many injections do we need? And it's designed for one injection. However, people could use a booster at different points with a different type of product, but it's designed for one injection. What is the percentage of getting well? There's not an exact percentage, but the majority of the patients that we select will have a great outcome. The side effects are like any joint injection. You could have an irritation where the injection site is. You might develop a slight increase in temperature for a day after because it modulates your immune system. And one other most important question people may have, is it covered by insurance? And cell-based therapy is not covered by insurance. But imagine what it would be like to be able to sleep through the night, or to wake up and have energy, or to not go through your day in pain, not have to negotiate your day with pain, not to have to take Advil, aspirin, cortisone, steroids to block your pain, which have other side effects in your body. Because everything you do that's masking your pain is having a cascade negative effect somewhere else in your body. So you wouldn't be doing medications anymore because you wouldn't need to. And you'd have a different level of energy because your energy is not going to be drained by the pain that you have. And most of all, you'd be able to gain independence and be able to do some activities that you've given up because of your pain. You want to wake up fresh and feel good. And that's the idea. And that's what I want for all my patients to have. To know that there's an option outside of surgery. We say, regenerate before you operate. Because if you can get better in this form, your life will be different, your quality of life will be different, and you'll even forget the pain that you had. So I know that many of you watching this have probably been told you're bone on bone, you need surgery, you have osteoarthritis, you might be a failed low back surgery syndrome, you could have chronic neck pain, chronic headaches arising from your neck, you could have pain down the arm from your neck. All of these types of conditions can often respond well to cell-based therapy. But in order to get a result or to find out, you have to do something about it. You think about it every day, you've tried different things, they haven't worked. This is a different approach. You're not doing the same thing you've done before. It's completely different. It's working with your body to get your body to heal itself. So the way to find out is to call our number, 786-327-7078. That's 786-327-7078, or go to our website, regeneratewellness.com. Look at our information. Sign up for a consultation with us. Call us directly. The only way you're going to know is to meet with us, do a functional exam, have us review your x-rays, your MRIs, and see if you qualify for a personalized care plan using this therapy that can change your life. Come and see us. We want to help you. We want to offer you something different so you can benefit like the rest of our patients have. Hopefully, we'll see you soon.